get started. Okay, so thank you for being here. I hope you've had a chance to grab your water, to stretch a little. Yeah, we're here today talking about large caseloads, which I know is definitely something that is an everyday experience right now with all the people that are coming in. I think it started when we had our Cuban Haitians coming in, and then the APAs that came in within a very short succession, and then the Ukrainians, and then it's just been a pile up, and now we have the Cuban Haitian parolees. So it's just maybe the right time to be just talking about how do we go about managing the caseloads that we have. So our agenda for today, we're going to look at overview of case management. Then we're going to talk about the key stakeholders in case management, the key principles of case management and the challenges that we experience as case managers, and how to set boundaries and to enforce them, and then the best practices for case management. And we're going to start with, again, a Slido. Pardon me, maybe this is the last for the day, but what are some of the words you associate with case management? When you hear the word case management, what comes to mind? Please feel free to scan the barcode or put the code that is there and share what your thoughts are on case management. Case notes, yep, that's true. If it's not written down, it did not happen. Time management, yeah, there's a lot of balancing. Yeah, people, our clients are the core of what we do as case managers. Help, yeah, I think that's a big one. Self-sufficiency, time management is really coming up big, because that means a lot of people are voting for time management. And case notes. Communication, definitely. There's a lot of interactions. Data, yes. As part of case management, we're also putting in data on different sites, internal and external. Consistency, yes. Translation and interpretation, because definitely not all our clients speak English. So there's that aspect of it that eats into time management, and the amount of time you spend with people. Okay, so I guess those are some of the words definitely that are associated with case management. And we'll just go boundaries. Yes, I love that. It's a big one, boundaries, making sure that we have the right boundaries. Problem solving. There are a few more people that want to put in their thoughts there. You're welcome to. But yeah, this does definitely speak to different aspects of case management. And as we go on with looking at our caseload and how to deal with case management, those words will come up a lot more. Okay, so we're gonna move on from that and look at the overview of case management. So case management is a process that facilitates achievements of client wellness and autonomy through advocacy. So we are advocating for our clients to different partners. Assessments, we are doing intake assessments, we are doing employment assessments, we are doing FSSPs as form of an assessment. And it's being able to uncover what trends are the clients coming in, what areas do they need, what barriers are we navigating. So those assessments give us that. And they also help with the planning. So where do I place a lot of my time, or how do I plan my time to make sure that I am encompassing all that the client wants me to do for them. And communication, how do I communicate with my clients? And internally, how do we communicate to make sure that we are on the same page when it comes to case management as an agency? Coordination of services, coordination of referrals, coordination of and when it comes to clients, how we are coordinating external stakeholders to make sure that their needs are met and they are able to handle stuff by themselves, for example. Monitoring, so we are looking at how we're doing when it comes to case management. How are we serving the clients? How are we helping the clients get to their goal? And then service facilitation would be some of the ways that case management, we achieve wellness and autonomy through some of those ways. And then talking about the stakeholders that are involved in case management. So of course, the important person is the client. We are client-centered. All our work is around our client. We are looking for what their needs are, what are their strengths. Our goal is to partner with the client to decide how we can support them. I would think of us or agencies being like a GPS, So we're a GPS, but the client has to plug in the destination they want, how many stops they want. Maybe those are the barriers that they'll have along the way. So, and we're just working alongside them to make sure that they end up at their destination. So we are not supposed to be working by ourselves. We can provide all the services. We have to think, about who are the other people in the client's lives, and those are the stakeholders that have a role to play in their lives. So we are looking at what are their social networks. What do they go to a house of worship somewhere? Are they involved in the community in any way? And how do those resources that they have as family, friends, and community play into how do we help our clients plug into those services? And how can we refer them? How do we work alongside those connections to make sure that we're serving our clients? And on the other end, I know this might be really small, could even small for me to say, is the professional and networking community. So this could be your the professional bodies like your medical providers, your education providers, your board of social services, or the public benefits. So we're also working alongside our clients to make sure that they are able to have those benefits from the society. How are they able to access the services that are provided in the society for them? We are not working in a vacuum. I think recognizing that we're not working in a vacuum is one step in making sure that we don't feel overwhelmed. If something can be referred out or provided by somebody else, we want to do that. And also realizing that the clients have their own social networks, and that influences the way they think and the way they behave, and it's a reality. So we have to help them build those networks so that they can thrive in that environment that they've created for themselves. Then going on to the guiding principles for case management, because at the end of the day, the most important thing in case management is the relationship that you build with your client. So managing that relationship is at the core of your work. And part of that is we should have some principles that guide that. And one of them would be mutual respect. You don't have all the answers and all the resources that a client may need. So we assess their goal, we assess their needs, we set their goals, we help them navigate through barriers, but we also appreciate that they have their own strengths that they're bringing to the table that we can tap into, right? So we are not saying we are here to run your life. We are here to work alongside you to help you reach your goal. And when you think of a client as being whole, I think those who have come to the financial coaching training, we have a mantra that says our clients are, they are what? I've forgotten the mantra. They are whole, their whole, oh my God, that has escaped my mind. I should have written it down somewhere. But if someone has been to the financial coaching training, we really emphasize on the clients being whole. They are able to make decisions. When you think about the journey the clients took from wherever they came from and the journey they've taken to come here, and they've succeeded. That's already a strength. So honoring that they're an expert in their own life and you're just here to hold their hands and guide them in the right way would go a long way to building that relationship. And it also alleviates a lot of pressure from you to feel that you have to provide all the answers. Sometimes asking the client, what do you want to do about that situation? They would come up with a more befitting answer that they'll be able to follow through than what you could instruct them to do. Then that goes into making sure that we have equity in care, So because we are honoring that they are able to do what they can do for themselves, maybe it gives us more time to deal with a variety of clients and being able to provide time across the client caseload for everybody. So we are looking at how time management and the client's needs and the caseload and trying to say, how do I make sure that I'm serving all my clients in an equal manner? Then the right to self-determination. They are truly the guide to their own lives, like we said. So they need to decide what is a priority for them, right? So sometimes the priority for us is the program goals. You need to get a job because that's my program goal. But what's the priority for the client? Maybe the client is saying, right now, I feel like this is what I need to do first. I need to go to school first. And it's how you navigate that conversation to make sure that you appreciate that they have a right to determine what they want to do. Then cultural humility, we are serving people from across many countries, across many cultures, and being able to acknowledge the fact that we don't know everything about all the cultures. And so we are learning. So we are coming into the case management scene with a lot of curiosity. We want to know what the clients have to tell us and how they can teach us and how we can be able to serve them from their cultural lens. And then, of course, do no harm. We are trying to make sure that we are attentive to there's no emotional, physical, or environmental safety or insecurity for our clients. And that could be in how we treat them, how we talk to them, for example, because these are people that have been through trauma and we do not want to re-traumatize them in any way. So just being cognizant of that fact that we do not want to do any harm as we're building this relationship with our clients. And then looking to the socio-ecological perspective, and then that speaks to the connections that we spoke about earlier. There are many social connections and other systems that we're interacting with, and maybe even systems that they are coming from that influence how they think and how they behave. Being cognizant of those facts help us to build that relationship in a way that will be beneficial for both the caseworker and, of course, the client, who is the main person in this scenario. Then the impact of how we label and the languages on our work. So we have to be attuned to how we speak about our work and the activities that we facilitate. Sometimes we not in a subconscious way look like we are the experts, right? We want to help you. We want to do this. What does that speak about? What does that say about the client? They're not able to. Are we drawing their strength when we say we want to do this for you? So how do we label ourselves? How do we work together? Then language is reflective of how we see our clients and our expectations from them. So if we think that they can do nothing for themselves, we will end up going full force and trying to do everything. We want to, they're supposed to pay their rent. Instead of teaching them how to write a money order, you end up doing the money order by yourself and not teaching them. At the end of the day, that increases your workload because your expectations of them is that they cannot be able to do this by themselves. But if you write the first money order and teach them how to do it, make a copy of it for them to take home. And the second month you come and they write the money order and you come and make sure it's correct and tell them they have done a good job. Then the third month, they're going to be doing the money orders by themselves, So how do we empower the clients to be able to do some aspects of what we do? Awareness of how descriptions may label clients and with inherent value or cultural judgments. So sometimes, again, that's speaking to the subconsciousness. Sometimes we may say something that comes across as a judgment. And if it's in the client's hearing, maybe they will be shy of coming for services in future. Use labels that impact access to care and other service engagements. So we need to to empower our clients with our words that you can be able to do this. You are able to access this service. I can give you your caseworker's number at the social services department, and you can be able to make that call. You can be able to ask for, for interpretation if that's your barrier. So being able to empower our clients by the way we speak to them, by the way we label our work with them, will go a long way to making sure that our clients are self-sufficient, or they're able to do some of the work that maybe we are doing for them right now. And going on from there, so I would think about how do we introduce our role as a way to, to set the stage when you're meeting your clients for the first time. And like we started with the Slido, you see that case management has very many different words, and different things come to mind when you think about case management. It encompasses a lot of things. So sometimes it is hard for you to explain your role in a way that honors the client's expertise and the clients and the expertise that you're bringing to the table. So I would take this just as a sample of how you would introduce yourself and see how the different aspects of your introduction are already setting boundaries to what you can or cannot do. So I would just read it as a case manager. My role is to work with you to help you access the support and services you need to feel stable and supported. This case management program will last for this period of time. It's good for them to know that programs are time-bound. In that time, we will work as a team to identify your goals and how to navigate your barriers. We will create a plan together on how I can support you. You can reach me, so you're making yourself available. You can reach me on whatever number or email to schedule an appointment if you need to come in and see me. Our office hours are this time. So again, you're setting boundaries there. You're saying we can only work around this time. You can text me and I will do my best to respond within. What's your commitment? Are you saying that you can respond to your clients within 24 hours or 1 business day or 2 business days, depending on your caseload? So that's already in introducing yourself. You're setting the expectations for the client and for yourself. And you're setting some parameters of how you're going to work together. And the client will know that from the word go. So all that said and done, we still have challenges that we have to navigate when it comes to case management. And of course, the first and the most glaring one is the large caseload that we are having. Yes, you're introducing yourself the right way. Yes, you're trying to set some parameters, but there's still a large caseload. There's still just so many people and just a few people doing the work. And the complex needs of the client. So clients come with varying needs. I think for anyone that's working in this field, every day is a different day. You can't even have a day that you can say is a sample day of what happens. You wake up in the morning and just things are happening and everything is going around and clients are calling with different complex needs, and we have to attend to that. So it's just being cognizant of that. And of course, paperwork requirements. There's a lot of paperwork when it comes to case management because we need the program compliance requires that we are taking your enrollment paperwork. We are taking maybe your pay stubs. We are taking your health and medical documents, for example. Of course, there's the feeling of being overworked and underpaid, and the trauma-exposed work environment. We are working with people who have been through trauma, so we are also exposed to that trauma by either listening to their stories and having having to process what the client is telling you, and that leads sometimes to burnout, vicarious trauma, and compassion fatigue. So it's like the process of change resulting from the empathetic environment that you're in and your engagement with trauma survivors. So sometimes that trauma can be passed on to you, and it's just things to know so that you can avoid the burnout and the vicarious trauma. So one of the things that we've talked a little bit, especially in the introduction, is about setting our boundaries. And we just want to just deep dive a little bit into setting boundaries because they're the first things that's the first way to manage your caseload when you have those boundaries. And they're essential because they, first of all, establish an atmosphere of mutual respect. right? If your client knows that you are going to respond within 1 business day, then there will be no need for them to be calling 30 times in a day, right? So there's that mutual respect, and you're keeping your end of the bargain. If you give a commitment that I will call you within, I'll return your call, your text message in this particular period of time, then you're following up and doing that. So they reinforce a professional relationship because you have, for example, you say your working hours at this time, beyond work hours, this is what you can do. You're training them and empowering them on what they can do when you're not available to help them. So you're enforcing that professional relationship between you and the client. It also helps to support equity, as all clients receive consistent service treatment and care. And this goes a lot to sometimes when we have clients that speak our own languages, they tend to become very dependent on the person that speaks their language. So once you're aware of that, and you need to make sure that your time is equitably among all your clients, even those who don't speak your language. So it's good that you're able to make sure that it's consistent. It doesn't matter if they are clingy on you, and it's understandable when they find someone that they can speak their language with. They're more willing to share more. They're more willing to come to the office more, maybe to see you, make appointments, whatever, because they feel like you can help them. You're one of us. But being able to know, yes, I can help you, but on this part, you can be able to help yourself, or being able to make sure that whatever services you're offering are equitable across all the clients. And they help with work-related work-life balance, because then you're able to say, okay, I work 9 to 5, I switch off my work phone, and I'm able to, re-energize myself using other activities and self-care, and this is crucial in this kind of profession that we are in. If we don't practice self-care, we end up with burnout, we end up with vicarious trauma, we end up with compassion fatigue, and it's because we are carrying everything along with us by not setting the right boundaries to begin with. And boundaries, when you talk about boundaries, people sometimes take it in a negative way, but they are definitely positive ways that we can define boundaries. And I want us to just, in the next slide, to just again scan the code. I thought that the slide was the last one. Please pardon me, and let's do this one more together. Words that you can use to define boundaries in a positive manner, because sometimes it has that negative connotation. So you want to scan the code and share how you think we can define boundaries in a positive manner. Respect, yeah. Mutually beneficial, that's true. Privacy and respect, that's definitely something. There are safeguards, yeah. You're safeguarding yourself, you're safeguarding your client, you're empowering them to know that they can take care of some of the things that they expect you to take care of. Comfort, yeah. Listening, self-care. Self-care is a big one. In this kind of field, we really need to think about how can we take care of ourselves and be able to still serve our clients. Understanding, distinguishing roles, yes. It's a healthy conversation, understand, yeah. I think respect is popping out as the main one, right? You're trying to respect the client is trying to respect you and respect your time. And I think that way you'll have a lot, you'd be able to achieve a lot than when they can access you anytime. Yeah, thank you so much for all contributing to this conversation. It definitely, those words really, they show that boundaries are positive. So let's not think about boundaries as something negative, something that, we don't want to do or be uncomfortable to do. But think about it as, we are trying to respect our time, respect the client's time. We are trying to, to practice self-care. We are trying to have a work-life balance. So we shouldn't feel guilty if you have to switch off your work phone after 5 o'clock, your family comes first. Your work-life balance is important. Yeah. And when you're well rested, you're sure to come and do a better job tomorrow than when you're carrying over stuff for it, you carry it home and come back in the morning with it. Thank you so much for participating in that. And we'll keep going. So then the next thing is we have set our boundaries. We know it's important to have those boundaries, right? It's respectful. How do we make sure that we are enforcing those boundaries as we go along with the clients? So so give reminders. So like any boundary, anyone who has a child knows whenever you set a boundary, a child will try and push it. And that's how we are as humans. Whenever there's a boundary, we want to try and push that boundary to see how far it can go, right? And I know that the biggest boundary pusher is because our clients sometimes feel like everything's an emergency. But is it really an emergency? Yeah, we want to help, but is it really an emergency? So give reminders. Someone calls you at 5 or texts you at 5, you can tell them, you can text back and say, hey, remember I work 9 to 5. This is really urgent. Or I'll get back to you tomorrow morning. Something like that. If you want to respond, if someone is like consistently calling, you can try and find out what's going on, but remind them that this is past your work hours. Give those reminders. Use consistent messaging. One thing is that when one client receives some preferential treatment, for example, from a particular caseworker, it goes around the community. Oh, you can call Veronica anytime. She's going to take her phone, right? And you'll find even clients that are not your clients are now calling you for help because the message has gone around that you are good and you can be able to respond to them when they need you to respond to them. But when it's consistent messaging across the board, right? If it's an administrative day, it's an administrative day. We are not taking calls and it's blocked for everybody. It's across the board. It's very important. It helps to enforce those boundaries. And that means that if we agree as a team that this is how we are going to work with our clients, this is our working days, for example, these are our appointment days, these are administrative days, and you keep those boundaries like that, and the clients understand that, then they're going to be able to start respecting that. Provide referrals where possible. And like I said, we're not working in a vacuum and we do not have all the answers. So if you can provide a referral and give the client a contact that they can be able to get help from, please go ahead and do that. We don't have to figure out everything. If you can have the resources to share with them and they can be able to take charge of their life and be able to follow up with those resources, then you can do that. It helps to enforce the boundaries. Seek support from coworkers and supervisors. Sometimes we just have too much we're doing and very little time, or or maybe a very needy client. Seek support. Go to your supervisor and say, hey, I have this client that is really consuming a lot of my time and these are the issues that they're going through. Would you mind stepping in and having a conversation with them, right? Document and follow up any boundary crossing. So it's very important for us to keep documenting what's going on, right? Because only then can there be strategic change. If you find that clients are calling so much over the weekend or calling so much after hours, and maybe you then realize that mainly the clients who are calling after hours are actually people who are employed, so they're calling us when they come from work, right? And maybe their needs are valid. So how do we document this and discuss this internally to say, okay, you can have a flexi time where you start your day late and work later to be able to address those very needs? Or how do we address that in a way that is strategic and in a way that still enforces the boundaries? And beyond your work shift, because we definitely have limited time in which we can work in a day. We can be 24 hours, we're not on call. So how do you deal with that and still manage your client needs beyond your shift? Use a strength-based approach. All people have strengths and capacities to overcome adversity. And like I said, these people have been on a journey that you know nothing about, and they have overcome. They have come here and they have made it through. They are able. We can be able to tap on those strengths to teach them how to work, to resolve their issues when it's beyond our shift hours. So in some instances, let's say it's like vacation time when people are taking, a block of time together, we can have rotating staff members. Maybe it's the Christmas season. And we know that people we need the work-life balance. So how do we rotate to make sure that we have coverage during that time? Or assess our client's urgency needs carefully. So if a client is calling and saying their needs are urgent, are they really urgent? Yeah. Are we looking at, so of course there's some things that are urgent. If a client heat is off and it's in the winter, it's below 20 degrees, we need to do something about it. We need to make sure we call the landlord and make sure it's fixed. But does the client have access to the landlord information, for example? Have they tried to contact them? So assess the urgency of the needs carefully and see what can be done, because of course there are emergencies that happen, and then provide resources for that. So if there's an emergency, for example, and you already taught your client how to make a 911 call, like if it's a health emergency, sometimes even if they call you, there's very little you can do. So, but if the client already knows if you have a health emergency, you can call 911, you can get the help, you can be able to talk. They have a language line that you can be able to ask for the specific language that you need. That empowers them to know that if there's an emergency out of office hours, I can do this for myself. Recognize and celebrate the client's unique strengths and cultural assets. So once they have done something that you know is something that you can tap on, they have achieved something by themselves, recognize that and celebrate that. I really like that you're able to resolve that issue of heat in your house. I like that you're able to have that conversation with your landlord and it was resolved. Acknowledge that, because when you acknowledge it, you're building on that and you'll be able to be able to continue with that same trend. Provide after-hour plans and resources. Sometimes we set voice messages, or if you're using WhatsApp to communicate with your clients, you can set a profile message that says what the plans are. If you're planning, let's say, to go on vacation, for example, you can say, I'm going to be on vacation from this time to this time. This is the person that you would contact if I'm not around. Then stick to your work schedule and your professional boundaries where possible. Definitely, we said if there's an emergency, sometimes you might need to switch that around. So, okay, talking about the caseloads and just looking at the numbers, I have another slide. I apologize. I think I had one too many in this presentation. But how many clients were served in FY23 in New Jersey? And I think if you attended the first day of training, you might have a clue on how many clients were served. 17,000, 16,000. Oh, I didn't even notice that 498 and 598 are similar. Okay. I would really appreciate to see more participation on this one. I want to know how many clients you served from all of you. Yeah, okay. Thank you. Thank you for your participation. And those numbers are actually, all of them are correct. They just represent different numbers. The only incorrect number is 10,300 that I just made up. But the rest of the numbers represent different numbers that you will see here. So the 17,598 is the total unduplicated clients that were served in FY23. So that's a big number. And just a thank you to all of you that have put in a lot of work and effort to make sure all those clients are served across the state. Big thank you for that. And then the 9,000 is the number for the RCA, the clients that were served, and the 16,000 is the number of RSS clients that were served. So either one of those would have been a correct number, but the total caseload unduplicated was 17,000 clients. So again, this is just to show the enormity of the caseloads that you're managing on a day-to-day basis. And sometimes we only look at our caseload from an agency perspective, but being able to look at the big picture and see what we are doing across the state is really important. So thank you for all the amazing work that you're doing to manage the clients' needs and to make sure that you're serving them with case management. So now we're going to move on and talk about best practices for caseload management. And again, I split it between what supervisors can do and what direct staff can do. So for managers, creating a chat flow of services. Yeah, we have so many varying services that we offer, and they are kind of in buckets. And sometimes staff don't understand who's offering what. But if there's a standardized, flow of services, you enroll into the program and this is what happens next. These are the services that you're provided at this level. So that flow of services would be beneficial for everybody to know how or what role they play. So creating that flow would be good for the agency. Then breaking down deliverables to create quantitative goals. So sometimes we have overall deliverables, but then if we say we're supposed to serve 4,000 people, for example, in a particular program, how do you break that down into smaller goals that can be met by different team members? Because then that makes it's like it gives the caseload in bite pieces, right? So between October and December, this is what we need to have done, and this is your part of the responsibility to achieve that. Then between January and March, you can break it down whichever way you want to do. It could even be on a monthly basis. What are our targets for the month? So that it stops being overwhelming when you look at the big picture of we're supposed to place 500 people in jobs and we haven't gotten one person. How about we break it down and say, if we're supposed to place 120 people in jobs for the year, it means 12 per month. And how do we now strategize to make sure we place 12 per month? When you look at 12, it looks smaller than the 120 that you're looking at in a whole. So being able to break that down. Then assess performance of goals to align with program compliance goals. I'm sure most of the agencies, you have your goal setting. You say, this is what I want to do as an individual contributor to the program. And how does that align with the program goals? So that we are kind of holding ourselves accountable to make sure that we are achieving our goals. Then think about all the roles and the responsibilities that would be required to make sure that this caseload is well managed. Yesterday, we had a discussion about job development essentials, and we were talking about would it be different if we had job developers as a different strategy and having employment specialists who deal with the clients directly? Is that something that works for you? We want to see is that something that would be good for your agency? So you think about those roles and the responsibilities, who is in charge of what, and breaking down those pieces, again, helps to break down the caseload. I know a lot of people have changed how they do their intakes, for example, because when we started, the RCA program was really small, but now it has grown exponentially. And the structures have changed from having, just caseworkers doing everything to having intake specialists, for example, who are doing a particular role that, again, reduces the burden on the caseworkers, or having data specialists who are doing a role that, again, contributes to the overall caseload. So that goes to enumerating all the roles and the responsibilities and being able for people to see where do they fit in and how much of the caseload do they carry. Creating accountability mechanisms to check on progress. This could be team meetings, could be one-on-one check-ins. From NJOR perspective, we check on progress using monitoring and compliance. So that is definitely something to keep in mind. Then decide which administrative tasks can be outsourced. Some of our work have a very heavy lift or a very heavy administrative lift. And these are things that maybe we could have interns or volunteers do. So how well are we, how many interns do we need to be able to perform this work? How well can we train them, invest in training them maybe on client track so that they're in charge of doing certain administrative pieces. That way you're freeing the caseworkers to concentrate on other aspects that may be more pressing and that maybe the interns and volunteers may not be able to take care of. Then creating administrative days with limited interruptions, so there are no meetings, there's no client calls on those days, and it's just a time for people to focus and be able to achieve the goal that they have for themselves, whether it's data entry or whatever part of caseload management that they would require. Then performing monthly audits by selecting a few files and giving clear feedback. So as a supervisor, you can go and grab a couple of files, look at how they look like, and be able to give feedback to the particular caseworker. That way they're going to improve on what they're doing and how they're managing their caseload. And moving on from that and just continue with best practices for managers is having standard operating procedures. So like having a standard case note. We know how programs, we have an intuition about how programs run. Like I said, case notes are stories. You're telling a story from the beginning to the end, but there are some aspects of it that are really standard. Like an enrollment case note could be really standard. If you have those templates that people just pick and plug in and put in the right information, it will go a long way to making sure that there's less workload when it comes to like administrative tasks. Again, having a file checklist. If you have a checklist that says, an RCA file should have enrollment paperwork, should have RCA checks, should have whatever it is that they need to have, the FSSP, the budgets. So that file checklist, and then it goes to the next point of having a golden file, to use as a model for training. So when you have that checklist and you have a golden file that you have created, that people can go in and look and be able to evaluate for themselves, do I have all that is needed in my file? And they can pattern it against that. They don't have to recreate the wheel every time. So having templates and things that the caseworkers can use would go a long way to making sure that it reduces the caseload. Cross-training staff on eligibility for complementary program delivery, right? So if you're doing RSS adjustment, for example, and someone else is doing employment, if I know the eligibility requirements for RSS adjustment, for employment, for financial capabilities, then we can, when I know those things, then I'm able to either refer clients well, because I know, okay, this client is eligible for this program. I can already do a referral or do co-enrollments. And we're going to talk about co-enrollments as a best practice later on. Then prioritizing cases, and we talked about that yesterday. We saw that we have a priority list that is enshrined in our CFR 400. So we work with people who are new in the country first, so newly arrived refugees and other ORR eligible populations. Then we work with the second in priority with people that are receiving cash assistance. Then the third in priority would be people that are looking for employment, and the fourth priority would be for people that have employment but have other barriers that they are facing that we need to eliminate. So look at that list and see how can you prioritize that. And then that goes hand in hand with creating a wait list for services. Sometimes we are just not able to do everything right now, right then. So how do we create a waiting list that is again using the priority list? A wait list for our services, we say, okay, we're going to be able to take this number of people now, and then in 1 month, we'll be able to take an addition of this number. So being able to break that in chunks so that people are not feeling overwhelmed. Of course, there are services like RCA, which are mandatory, and people have to receive their services within a particular period of time. So that is understandable. And of course, we have, the policies and the rules that go around if someone's on a wait list, and how much or the benefits they can get back paid, so that the clients are not losing their benefits by being on a wait list. Then again, adaptation of strategies for intake and enrollment, and I have seen this across the agencies. People have really adapted how the teams are structured, how they are doing their intakes. Previously, we would do, one-on-one intakes. People have moved to group enrollments or group orientations and then personal enrollments. Whatever works, it's good to explore different ways of doing it that would make it easy. And feedback can be received from the caseworkers on how do we best, deal with this. Then for caseworkers, create a comprehensive to-do list, right? You can start with an overall list of all the activities that, that write down everything that's on your plate. Or you can use a template or a tool, whatever keeps you accountable. And then now you can start looking at what is a priority. And in terms of looking at what's a priority, you can apply the Maslow's hierarchy of needs that talks about, prioritizes needs based on urgency. So, of course, things to do with shelter, safety, food, then that's urgent, right? You want to deal with those fast. And then, the next hierarchy of needs would be things to do with what? Like resources or, getting psychological needs met, those are secondary. And then we can talk about other needs when it goes to, the Maslow's hierarchy of needs, where it talks about, self-actualization. Maybe those are things that you're not going to deal with in case management. But I think the most basic are the first two. The hierarchy of needs is the most basic needs. The shelter, the security, the food. Those basic needs have to be met. When you're talking about employment, resources, health and property, those are the second level. And I think for case management, we are dealing with mainly those two levels. So when you're looking at a client that is saying, my food stamp card has not been loaded, I don't have food for my children, we're not going to say, oh, that's not urgent. We can say, hey, we have this contact of a food bank that you can go to and get food for tonight, as we try to resolve the issue of the food stamp. So you're trying, or the client comes to you, it's a winter day and their heat is off, or they're being evicted, then we will try to address that need first. And we'll address that because it is important. So assess the deadlines and the urgency. It goes line in line with assessing, the hierarchy of needs. So if there's a deadline, like an eviction I just mentioned, they're going to get evicted in 3 days, then we really need to send them to agencies that can be able, we need to send them to Proceed. Where can we get this money to make sure that they're not evicted? So it's urgent, so we need to work on that. It has a deadline, we need to work on it. Then if tasks are truly equal in need and urgency, then alternate time to work on both. And this is where we also elicit help from our supervisors. I have these two very needy cases. Do you mind helping me with one? I'm trying to call Proceed to make sure that I can get, some rent money for this client, and this client needs to go to a food bank and they don't know how to get there. Could you help me with that? Because they are equal in need and the urgency. Then complete easier tasks first. I think it feels good when you accomplish something and it makes you feel good about yourself. So if you have an easy task that you can tick off from your comprehensive to-do list and you do that, it boosts your morale. So you can do that first, and then you can schedule more time-consuming tasks. And the way I would schedule tasks myself, it depends on how you work as an individual. There are people who are good at they are morning people, for example. So when you know yourself, I'm a morning person, and that's the time I concentrate the most, and that's the time I want to do maybe whatever is time consuming the most, then I will schedule my calendar to look like that. Then you can break overwhelming projects into smaller tasks with deadlines so that, again, you're breaking from the big picture to a smaller picture. Going back to the example of the employment, you have 120 for the year, 12 for the month, your 3 caseworkers. What does that mean? Like you have 50 people on a wait list to do an intake, your 12 caseworkers. How do we break it down to make sure that we meet those smaller tasks within particular deadlines? And then best practices is, again, continued, find time for documentation by prioritizing tasks, again, setting boundaries with clients, scheduling time with limited distractions, And most importantly, don't let it pile up. I know there are times that there's just so much happening that you open an Excel sheet and just keep putting sample notes for your case note. And before you realize, you're 1 month in and you've never transferred your case notes to a database. So don't let it pile, because the more it piles, the more we forget, the more data is missing, the more work we have to do. And then you end up maybe going home and spending a whole evening working on case notes when you should be resting. And then use of structured templates as a best practice. Then another best practice is doing co-enrollment, and that will vary from agency to agency, but co-enrollment should improve staff capacity and provide in-depth service. So you avoid siloing. Siloing is where one program or a department operates in isolation from the rest of the organization. Nobody knows what's going on there. Nobody knows when they do their intakes, you know? So let's share information, share program cheat sheets. If you have a cheat sheet that says this is the purpose of the program, these are the timelines, eligibility requirements, this is how you can refer clients to us, and it's shared across the board, then I know if I meet a client who's telling me I need cash assistance, I have a cheat sheet to already screen them and say, okay, then I can forward them to the RCA team, for example, or I can forward them to the RSS adjustment program because they fit within that. Have program shadowing. You know, if time allows, let the new staff shadow all the programs when they come on board, and they get to know what every program really does. And that gives them the knowledge to be able to deal with clients holistically, because the truth be told is that most of our clients are being served by so many people in the company, in the agency. So if I know that, oh, this client has a lot of medical needs, I need to send them to preferred care, then I know everything about preferred care. Or I know the basics. I have my program cheat sheet for that, then I'll be able to refer them there. So, and establish co-enrollment mechanisms, enrolling clients into multiple programs simultaneously. So, for example, if you have someone that's willing to do job readiness training and wants job placement or financial capabilities, we can co-enroll them. And ultimately, we are also going, by co-enrolling clients, we're also getting to achieve our goals, our overall goals across all the programs at the same time. Then how to make co-enrollment work? There has to be alignment in a few factors. So participant eligibility, we have to know the project calendars. So if a particular program, I'll go back to RCA again, have their calendar of how they do the intakes, for example, and we know that we'll be able to refer or be able to let them know that we have these clients that need to be enrolled into the program, if we have the project calendar. And then the program goals are in alignment with the client goals. So if I'm talking to a client and we are talking about employment, and they mention that they've been having, they are working, but they've been having issues with their budget, then already I'm thinking about financial capabilities, and I'm looking at what's your goal, what do you want to learn, and should I refer you for co-enrollment with financial capabilities? Then how do we message our projects? So it has to be in alignment how we message the message we send to our clients about the projects, right? So there's no contradiction. You're not double serving people, but we're saying, if you need this help, this is the person that you need to talk to. If you need job placement, this is the person that you need to talk to. And if you need this is who you're going to talk to. So that messaging has to be in alignment across the programs. Ensure that there is coordinated enrollment procedure for all programs if you decide to go the co-enrollment route. You can also do co-enrollment by filling out program enrollment paperwork and all possible programs at the same time in an initial meeting. I have seen this happen where maybe R&P clients are coming and RCA team is going to come and evaluate them for RCA the matching grant team will come and evaluating them for matching grant, and they're also doing an R&P intake. So it's like everybody's in the room, their education, people are coming to assess their needs for their children and school enrollment. So it's all happening in one day, and it's coordinated using maybe a Teams channel where we are saying, this family is coming in, these are the services they might need, who's available. And then you give time slots and everybody comes in and meets the same family at the same time. It saves time for the family instead of having them to come so many times to be asked the same questions over and over again if you all sit in the room and do the intake together. And then create and distribute a client's flow map or model to help determine when and what to refer to. And again, that speaks to what I've said, like if you have a group that you talk about, what do the clients need, who are we referring them to, and so who should be in the room when this client comes. And then whenever you have to hand over clients to another team, just make sure there's a warm handoff. You're just not giving up, we are closing out your program, and if you need more services, you can talk to so-and-so. How about in the closeout meeting, you introduce them to the person who's going to be serving them next, so that there's that warm handover of clients between programs. Then again, documentation as part of co-enrollment and referral mechanisms. We can do screening and enrollment and intake paperwork and use a shared database to put that paperwork there, which means that if you do an enrollment and you take all the clients and eligibility paperwork, and it's saved where I can access it. You're in RCA, it's saved where I can access it as an employment specialist. I don't have to call the client and get all these additional paperwork. My work is cut in half because I will be able to access it from the shared database and be able to see what I need from that file. Do I need to copy the files, or are we doing a combined file for one client? That has to be an internal decision. But having those copies available for all the team members makes sure we are not overburdening the clients by asking them to come over and over again and us having extensive meetings of things that we already have. It's frustrating for them, it's frustrating for us too. But if I know that this client is already being served, so there should be some paperwork somewhere, some intake paperwork somewhere that I can take and use, then I should be able to do that. And I said that I still recognize the fact that we have, different paperwork for different programs sometimes. So it may be different, but if I take maybe an RSS adjustment intake, there are a lot of information I could glean from there and just fill the blanks when I meet with the client. So that's what I'm speaking to. Then coordination of case management using meetings, case review channels, whatever channels the agency uses. If you use Teams, you have groups on Teams that are just about case coordination and just talking about how you can serve the clients together will ease the burden. Sometimes when you start talking about case management, because clients have a habit, they will come and tell you about their problem and then go and tell the other team about their problem and go and tell the other team. So you find employment, career pathways, financial, they're all working on the same problem. But when you have a team coordination and you can say, oh yeah, she talked to me about housing. Oh yeah, I'm also trying to get housing. Then you realize you're all doing the same thing when you could be doing other things with your time. So case coordination, meetings and systems need to be in place. And then lead for each cluster of activities, right? So we are saying, if it's employment, who's the lead for that? If it's career pathways, who's the lead for that? And having that messaging being very clear to the clients. And yeah, we'll talk about, last but not least, common referral mechanisms. Some agencies are using Microsoft Forms or a shared spreadsheet where people can just go in and see who has been referred to them. Sometimes we do email referrals. I have seen, and everything has their pros and cons. I've seen a lot of emails get lost because we get overwhelming number of emails, and you send me a referral, I skipped it somehow, and it's 2 weeks later and the client has not been contacted. So we can look for more, more ways to make sure that the referrals are coming on in a timely manner. Or if you're doing paper referrals and filing them, that's also okay. And if there's any other referral mechanism that I could have missed, feel free to chime in. I hope this has been beneficial to you and it will help you with managing the caseloads. I know it does not alleviate the number of people that we are dealing with, but hopefully using some of the strategies, it will make it a little bit easier to deal with that. And so with that, I'm at the end of my presentation, and yeah, any questions?
I just wanted to say this was a very, very, very good presentation. Thank you so much, Veronica. I feel like you were kind of in the brain of case managers as you were putting together these slides, which was very, very helpful and thoughtful. Any chance, are you going to be sharing these slides by any chance with? Okay, that would be great, because I would definitely love to go over this with our team, because there were some very good points that, I think our team could really use, especially as we're just growing and growing, and the caseload is growing, and it's really important for us to be organized, and also set those boundaries. So thank you very much for this. This was by far the best case management presentation that I've ever listened into. So thank you so much.
Thank you. I appreciate those kind words. And there are resources on Switchboard, and we'll put the resources together, because there's a lot of training on caseload management and just how to handle it. So yeah, there are further resources that, and I got most of my presentations from my Switchboard trainings. So yeah, thank you. And we are way past time. We are 1 minute past time, I think, a few minutes past time. And we're supposed to be running over. Like I said, we feel like it's middle school when we're running from room to room. So we are now going back to the main session to do our networking session. So thanks, Mariam. I appreciate your kind words. So thank you so much for coming to this session. I appreciate you being here. So let's go to the networking session. It's supposed to run from 12 to 12:30. And then after that, we'll have a break, and then the final session in the afternoon to talk about community resources. Thank you.
Thank you so much, Veronica.
Thank you.